All right, general rules. There's no partial credit on answers with multiple choices or responses. All of those new questions I showed you, there's no partial credit, okay? So in that, you have to get them all correct, but don't let that freak you out. I want you to read the questions carefully. I want you to use that new functionality. It's easy and it's intuitive. Use it to your benefit. The National Registry gives you a full minute for each question. And again, answer each question to the best of your ability. All right, I got a little ahead of myself. Here's the first one. You don't know all the words. People say to me all the time, I came out and there were words I didn't know. I look at study groups online and they say, I took the exam and I didn't know what half the stuff was. Well, I'm going to have some advice for you. Let's take a look at this question, which may give you an example of that. All right. A 49-year-old complains of left-sided chest pain. They tell you it started an hour ago and it's been constantly 4 of 10. All right, 4 on 10 pain. They deny past medical history. They have a 38-pack year smoking history. There are fine crackles in the lower lungs. Pulse of 96, respiratory rate of 16, 154 on 96, satting at 96% on room air. You should suspect. All right, you should suspect is looking for a diagnosis. Now, before you look at the choices, this is a lot of information here. 49, chest pain, sudden onset, 4 on 10. Deny past medical history, but they're a smoker. There are fine crackles, and those are rales. That's fluid in the lower lungs. Pulse is 96. The vitals aren't the smoking gun here. So I look at this and say, what's it going to be? Now I look at the choices. The first thing I see is Prinzmetal's angina. I was never taught about Prinzmetal's angina. What am I going to do? If you're a EMT, maybe a paramedic student who didn't pay attention, Prinzmetal's angina is a type of angina that's caused by a coronary artery vasospasm. But you don't need to know that because that's not the correct answer. Okay? Now, if you look at this, you got a couple different choices. You got 2 heart choices and 2 lung choices. If you look at that smoking history, you're going to be drawn to lung cancer or emphysema. But this guy has no past medical history. He's 49 and he's not complaining of difficulty breathing. So let's rule out A and C right now. If you are drawn towards A and C, I want you to learn from that and say, oh, wow. Yeah, he doesn't have difficulty breathing. And in lung cancer or emphysema, when they call you, that's probably something they're going to have. And you know what else? He has no past medical history. A 49-year-old doesn't just sprout emphysema. Now I've got choice B and choice D. Now, if I don't know what Prinzmetal's angina is, let's say you're an EMT taking this, and you're thinking to yourself, I don't know what that is. I'm not going to give it as much credibility, but acute myocardial infarction, sudden onset of chest pain, 4 on 10 pain. He's a smoker, which is a risk factor. The blood pressure's a little high, which is a risk factor. And there's crackles in the bases. Fine crackles are the equivalent of rales. That's fluid. Why is fluid in the lungs? Because he's having a heart attack. The correct answer here is choice D, acute myocardial infarction. So what did we learn here? Like I said, you got to read the question, not only for what's there, but what's not there. If you looked at lung cancer and say, other than a smoker, why would I think he had lung cancer? Emphysema. He doesn't look, what's emphysema? Then you go through and you look at the other ones. I want you to take that time. You get a full minute per question. That may not seem a lot, but I think it's really, really close. But let's take a look at the next situation. You have trouble choosing the answer, right? Let's look at a question where there's not a lot of wiggle room between the choices. And here's the question. Now, while the National Registry won't trick you, the patient or a family member may say something wrong. A 70-year-old complains of a sudden onset of dizziness. They tell you they think they have the flu. Their lungs are clear to auscultation, and they have good chest expansion. The skin is pale, but it's warm and dry. Vital signs are pulse of 48. Now it's okay to, when you look at a question, to go, ooh, just like you would on the field. Respiratory to 16, 88 over 56. Ooh, that's another one there. Setting at 93%. You should suspect. All right, now, 70 years old, sudden onset of dizziness. They think they have the flu. Their lungs are clear to auscultation. They have good chest expansion. That's in there for a reason. Skin is pale, warm, and dry. Pulse of 48, low blood pressure. I think that dizziness is because of the low blood pressure. I don't think that dizziness is because of the flu. The brain is not getting enough blood because the blood pressure is low. Why is the blood pressure low? I'm looking at the question, probably because the pulse is 48. So influenza, the lungs are clear to auscultation. Do you think the lungs would be clear for influenza? Rule out choice A. Reduced cardiac output. I like that because a pulse of 48, remember, cardiac output is heart rate times stroke volume. Pulse of 48 means that cardiac output's going down. That could lower the blood pressure and make someone dizzy. I like B, but I don't stop there. Poor alveolar ventilation. They have good chest expansion. That is there because they want you to not choose C. They gave you the information. Good chest expansion. It means they're filling up the alveoli because the chest is expanding and taking air in. So it's not C. Increased sympathetic stimulation. Sympathetic nervous system. Fight or flight. If I had fight or flight, my pulse would be higher, right? Because it increases my heart rate. The skin is pale. It could be warm and dry. I think it'd be moist. I don't think this is sympathetic stimulation with a pulse that low. This is choice B, reduced cardiac output. Did you see how I got to that? But did you also see how each one of those choices has some meat to it? You look at that and you, like some of your class exams, you read A, B, C, and D. Oh, it's easy, it's B. This doesn't give you the easy button. This makes you think it out. Dizziness because of poor perfusion, low blood pressure. Why that? Because the pulse is 48. Read that question, but also find it's what you value. They think they have the flu. That doesn't mean they do. Lungs are clear, good chest expansion. All the information you need to get this right is there. So this is one that all the choices I thought were a little challenging. So let's continue on with the next scenario. You have no clue. Every once in a while you read the question, you look at the choices, and you're like, I got nothing. I got nothing here. It might be nothing here looks right. It might be they all look right. It might just be, yeah, I got nothing. So let's look at a question that I think is a little bit like that and figure out what we should do when that happens. All right, so a 26-year-old complains of increased breathing difficulty over the past 2 days. They've been coughing frequently. Pulse is 108. Respiratory rate is 18. 124 over 88. Okay, pulse pressure seems okay. Satting at 91%. You suspect the saturation reading is low because they have. Now look at this. Inadequate tidal volume, many collapsed alveoli, lower airway constriction, and bacteria in their lungs. And this is a question I think you might get a little bit farther along in your exam, not to freak you out. A more challenging question. But let's reframe A, B, C, and D. Because what A, B, C, and D is a description of the condition. It's not the condition itself. Choice A, inadequate tidal volume. That's respiratory failure. Choice B, many collapsed alveoli in their lungs. That's atelectasis or pneumothorax. Lower airway constriction. All right, that's 26-year-old asthma, and I'd expect some wheezing. And choice D, bacteria in their lungs. That's an infection, and it's pneumonia. Well, now that I look at this as respiratory failure, pneumothorax, asthma, and pneumonia, It's a whole new question. 26-year-old, oh, it came out over a couple days. Coughing frequently. All right. Now, their SAT is 91%, and they complain of increased difficulty breathing. Respiratory failure, you have inadequate rate, inadequate depth, maybe both, and altered mental status. And this has been 2 days. You don't have 2 days of respiratory failure. Many collapsed alveoli in their lungs. No indication of any abnormal lung sounds here at all. I'm not going for that. Lower airway constriction. Do I see wheezing there anywhere? No wheezing. Bacteria in their lungs. Pneumonia. Increased difficulty over 2 days, coughing frequently. Doesn't that suddenly seem like the right answer? When you put this in perspective, you have to realize it takes time to answer some of these questions. Some of them, especially in the beginning, you're going to get in 15, 20 seconds. But that's time you put in the bank for tougher questions. And don't forget, EMT, minimum of 70 questions. Paramedic, a minimum of 110. But you've got enough time to do more questions. Take the time on the questions. The more questions you get right, the better chance you have of getting less questions. And that's really important. All right, next one. Am I missing something? Is there something there that I should see, but I don't? And I think that's really important. Let's take a look at this question. All right. Family reports that an 82-year-old appears confused. They fell and had a minor rib fracture about a week ago, and they developed a productive cough over the last 3 to 4 days. Coarse crackles are heard in the left lung. Pulse is a little high, respiratory rate's high, blood pressure's low, SATs aren't as bad as I'd expect. Skin is warm and dry. You should suspect. So it's looking for a diagnosis. So it's an older patient that's confused. Rib fracture, productive cough. Coarse crackles are heard in the left lung. Here's what I think happened. They broke a rib and they may have pneumonia. Now there's 3 things that cause the correct answer here. And if you haven't figured it out, the correct answer is sepsis. Urinary tract infections, pulmonary infections like pneumonia, and cutaneous skin infections. They're the top 3 things. 82-year-olds not taking deep breaths. And you know what? One of the first signs that we see in sepsis are that altered mental status. And I also look at those rapid respirations. Always makes me a little concerned for sepsis. But I have no indication that it's heart failure, because if you look at coarse crackles, they're only heard in the left lung. If it was heart failure, it would be in both lungs. Pulmonary embolus fell about a week ago, productive cough over 3 to 4 days, gradual onset. Pulmonary embolus is a sudden onset. Flail segment, minor rib fracture, that's not a flail segment. This is sepsis. They broke a rib, injured their lung, didn't take deep breaths. Take a deep breath and the rib hurts. Ooh, so they breathe very shallowly and bacteria accumulates in the lungs. You're 82 years old and you've got this for a week and you got septic. Why is it sepsis? Look at that blood pressure. 82 over 56. This is a very sick woman that needs to get to the hospital right away. All right, let's go to the next to last question here, see if we have time. Oh, what if the question seems really easy? Every once in a while you get a question that looks easy, but it's hidden, that there's depth in it that you might not recognize, because even single words make a difference on the National Registry. Here's the question. You don't need a lot of time to read this, maybe a little time to think about this. And this is a question that's one sentence, but it's powerful. And that you could get this wrong if you don't pay attention. All right, so which of the following signs would be considered the most reliable indicator of apnea? All right, now, which of the following signs, you want to pick one of the signs, is the most reliable indicator of apnea? Apnea is no breathing, right? This patient's not breathing. It's not dyspnea. It's not increased work of breathing. It's no breathing. Well, can you be cyanotic and still be breathing? Yeah. Lack of chest wall movement, not breathing. I like that. Unable to feel breath on your cheek. Boy, I got to tell you, somebody that's breathing really shallowly, I might not feel that. And it depends. And some people have hairy cheeks. I'm not buying C. D, absence of extremity movement. Well, that's going to make me do the CAB approach, but does that have anything to do with apnea? No. I think to tell if someone's not breathing, the correct answer here is a lack of chest wall movement. Apnea, no breathing. You can be cyanosis with some breathing, cyanotic. Unable to feel it in your cheek is awful subjective. You have to get right down in somebody's fat. Nobody wants to do that anymore. Absence of extremity movement. No, it's chest wall movement. So look at this question. If you got this right, it's because you knew the word apnea meant no breathing whatsoever. And that should direct you to lack of chest wall movement. Right? That is significant. That's the best indicator here of apnea.